Most people with a C5-C6 disc bulge don't need more treatment. They need the right sequence of treatment, and that's a very different thing. If you're still dealing with neck pain, arm symptoms, or numbness that won't go away, the most frustrating part is that you're doing everything you were told to do, and it's still not resolving. You try medication, you try physical therapy, maybe even general chiropractic. The pain eases for a bit, then it comes right back. And in the back of your mind, you're wondering if injections or surgery is inevitable. And trust me, I've heard this. The problem is that most approaches only address one piece of the puzzle, and a C5-C6 disc issue with nerve involvement requires more than that. In this video, I'm going to walk you through the exact structured approach we use when someone comes into our clinic with a C5-C6 disc bulge and nerve symptoms, not just to reduce pain temporarily, but to stabilize the problem so it stops coming back. If you have a C5-C6 disc bulge and you want to understand what actually has to happen for it to resolve, keep watching this video. Hey, I'm Dr. Paul Barnwell, a chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life that they want, using natural care instead of drugs and surgery. My mission is to help people understand their bodies and build long-term health so that they can live with confidence and purpose. If you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgery being recommended without a real plan, this channel's for you. You deserve clear answers, not quick fixes. In this channel, you'll learn what's actually happening inside of your body, what actually helps it to heal, and the information most people never hear in a routine doctor's appointment. Subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move toward a life with less pain and more purpose. I upload a new video every week. If your C5-C6 disc bulge was going to settle down on its own, it likely would have done that by now. Instead, the symptoms tend to linger and gradually become more frustrating. I've actually been through this. The neck feels tight or constantly irritated, and the pain starts to travel into the shoulder or down into the arm, sometimes reaching the hand. Then the numbness or tingling begins and doesn't fully go away. You may even notice weakness where your grip feels less reliable. This is when concern starts to build because it's no longer just pain, it's unpredictability. Sitting too long makes it worse, looking down aggravates it, and sleeping becomes uncomfortable. A C5-C6 disc bulge means the disc has shifted and is now irritating a nearby nerve. That nerve travels into the shoulder, arm, and hand, among other places, which is why the symptoms move. Most people are told what the condition is, but not why it keeps coming back. So they're told to manage it with medication, therapy, or sometimes adjustments that only give temporary relief, because the underlying pressure at C5-C6 has not changed. The cycle continues. The real focus is not just understanding the diagnosis, but what actually needs to change to stop it from coming back. That's where a structured approach really becomes critical, because without it, most treatments stay focused on short-term relief instead of actually changing what's driving the problem. So step one is precise diagnosis. We start with a detailed consultation to understand how the disc injury developed and how it's progressed over time. It's important to know where you came from and where you are. Then we perform orthopedic or neurological testing to identify nerve involvement and confirm that C5-C6 is the true source. We also use digital postural analysis to assess forward head position and cervical load, and we took x-rays when needed to evaluate disc spacing, alignment, and degeneration, unfortunately. The goal is to identify the exact level and cause, not just treat general neck pain. This gives patients clarity and confidence in what's actually going on. Step two is reducing pressure on the disc and nerve. Once we know exactly what we're dealing with, the focus shifts from creating space at the C5-C6 level. This is done through gentle, specific chiropractic adjustments, not aggressive twisting. We also use cervical spinal decompression, which applies controlled, gradual traction to the neck to reduce pressure inside the disc. This creates a negative pressure environment or effect that can help draw the disc material away from the nerve and improve fluid exchange. As that pressure decreases, irritation on the nerve is reduced, which is often when patients begin to notice less arm pain, reduced tingling, and improved nerve function. Step three is calming inflammation and accelerating healing. Discs have a limited blood supply, so healing depends on improving the environment around them. So we'll use tools like class 4 laser therapy that it delivers light energy deep into the tissue, which stimulates faster cellular activity. It increases circulation and it helps reduce inflammation. As the inflammation decreases, sensitivity around the nerve also reduces, which can lead to meaningful pain relief. In more chronic cases, shockwave therapy may be used to stimulate tissue repair, improve blood flow, and help break up long-standing irritation and scar tissue in the surrounding soft tissue. This is often where patients start to feel more consistent relief instead of short-term ups and downs. Step 4 is rebuilding stability so the problem doesn't come back. Once pain begins to reduce, the next step is making sure that the spine is properly supported. We use targeted rehabilitation to strengthen the deep neck flexors and the scapular stabilizers, which are essential for maintaining proper cervical alignment. Muscle stimulation may be used to re-educate weak or inhibited muscles, especially in patients who have developed compensation patterns, which is most of them. As stability improves, patients often are able to return to their normal activities like working, exercising, and moving without constantly triggering symptoms. Step 5 is correcting the lifestyle factors that cause the issue in the first place. If daily habits don't change, the disc will continue to be irritated. So we address things like your ergonomics, your posture, including your desk setup, your phone use, your sleeping patterns, so that the spine is not constantly placed under stress. Patients are given simple home care routines that include traction, positioning, mobility work, along with guidance on nutritional support, which is so important for disc and nerve health. This is what helps create long-term stability, allowing patients to sleep more comfortably, which is how you heal, function normally, and avoid the cycle of recurring pain or the need for more invasive treatments. So if you've made it this far in the video, it's probably because something is resonating with you. You're dealing with this issue, this C5-C6 or some other disc bulge, and you're dealing with these symptoms and you've done what seems like everything to fix it, and either you've gotten limited or no relief. Now you don't know where to go. You're thinking it's going to have to be surgery, something like that. But I want to give you some hope. And I want to just share two things with you. One, a particular patient, which I think we'll show here on the screen, and then my own story too. So I was in practice and I've had previous neck injuries from being a gymnast, and from just the workload that I've been under and probably not taking care of myself, I developed a C5-C6 disc bulge. And so it got to the point where I couldn't use my arm at all. I'm left-handed. This is my left hand. I have a very physical job. And so I was out of work, and it's a very scary place to be. And if you're in that place, I just want to let you know that there is a way to improve that. In fact, I have literally no symptoms now. I went months and months where I couldn't work, and then it slowly improved with all the processes. And the reason why I've tightened up our processes and our protocols is because I feel exactly what you are feeling. And there is a way to get better. You're not doomed to consistently be taking steroid injections or have to have surgery. There is a way to improve this and to heal it. If not entirely, then to the point where you can maintain life and you can actually improve and feel good. Another story that I want to share with you is a sweet, sweet patient named Amanda. I love all of our patients, but she just gave I almost cried when she was giving her testimonial, because I didn't even know the extent that it had affected her life. And she had tried everything. She's a business owner. She's got kids, and she developed this disc bulge that's in her neck, and it made her arm basically go numb and super painful. And so she went and tried everything. She went the most conservative route first, so she went to another chiropractor. She was under care for 4 months, and really no relief or limited relief. And then she went the steroid injection route. She had multiple rounds of steroid injections, which only gave temporary relief. She did all the soft tissue modalities and tools like the scraping and the myofascial release and the massage and all of that. Again, everything was temporary relief, and it's because the main issue was not taken care of. In one therapy, we may get some movement in the joint so that it takes a little bit of pressure off the nerve, and then you try a different treatment. It's just working on the soft tissue that's down here. But the actual loading of the disc, the posture, the mobility and the strength around that disc wasn't permanently improved until she came to Cornerstone. And when she came here, we put her through the exact same protocols that I'm telling you right now. and she saw significant relief. As she says, she's a completely different person. And I'm just so grateful that I get to do this every single day, to be able to help patients get their life back, and not only just get their life back, but be better than they were before. So I hope this helped you, and I appreciate you watching this far, and we can do the same for you, and I hope to see you soon. So you can see now that treating a C5-C6 disc bulge and the surrounding neck region requires thorough, structured approaches. It isn't one single treatment, but it's a multimodal process that addresses the disc, the nerve, the underlying causes all together. The goal of this video is to give you clarity on what's actually required to successfully treat a C5-C6 disc bulge. And if what you've tried so far hasn't worked, just know there are other ways to approach this that focus on long-term results, not just temporary relief. Look for a chiropractor or a healthcare provider who uses a comprehensive approach like I described in this video. That includes specific chiropractic care, spinal decompression, laser therapy, shockwave therapy, and targeted rehab with proper home care. That combination is what gives you the best chance at recovering. So if you found this video helpful, like and share it so more people dealing with a C5-C6 disc bulge can hear about this treatment process. And if you have questions, leave a comment below. I read them and I do my best to respond. Subscribe if you want a better understanding of how your body works, taking control of your health, and to follow clear steps that help you move with less pain and more confidence. And if you want 5 great exercises to help you decompress a pinched nerve in your neck and relieve the shooting pain in your arms, go watch this video.